The opinions expressed by the host and guests in this show are not necessarily the views of Children's Health Defense.
Good morning, CHD. It's Wednesday, the 21st of May, 2025. We have a really important show for you today. In a minute, Karl Jablonowski is going to come on from our research. He's a researcher, scientist, researcher at Children's Health Defense, and we're going to be talking about Hep B. Then we're going to be talking about this fluoride varnish with Lisa Laehy. And this is really important because we noticed on the medical records of the babies that have died that they're getting this varnish, fluoride varnish on their gums. So Lisa's going to talk about that. So I really need you to really listen to this because many of the pediatricians I spoke to in our movement had not heard of this. So this is, I think, been going on for a bit of time. We'll find out from Lisa anyway. And then we're going to go to Dawn Richardson with Advocacy Lifeline. She has some really important information on some bills that you need to know about. And then we're going to go for our story of the day. So busy show. So let's bring on Karl. Karl, good morning. And thank you for being here with us.
Good morning. Happy to be here.
Well, we had this article from The Defender, and you were quoted in it, and wanted to bring you on to talk about it. And I think Lou's going to put it, there you go. Hep B vaccine comes with high risk, little benefit. So why does the CDC recommend them for every newborn? Now, my first question to you is, I think a lot of people don't even know what hepatitis B is. So forget the vaccine for a second. Let's just talk about what even is hepatitis B.
Sure. So hepatitis B is it's a virus. It's a DNA-based virus, and it has an affinity for the liver cells, and so it enters liver cells and tries to replicate itself. And there are sort of three different stages of the disease. One is an acute stage where you're infected, your immune system identifies that you're infected, and it tries to fight it off. And the Mayo Clinic says most adults with hepatitis B fully recover, even if their symptoms are bad. And fully recover means you've completely gotten rid of the virus and you're free and clear. If you fail to fully get rid of the virus, you can enter into a chronic phase of hepatitis, which means for a long term, your immune system will be unable to combat fully hepatitis disease. And then there is a third called the occult hepatitis B infection, and occult means in this case hidden. So your immune system has beaten hepatitis most of where it is, and it has entered into kind of a dormant phase and lives in your liver. It usually does not cause a problem unless the host is immunocompromised through chemotherapy or something like that, where the virus could then reassert itself and cause some problems.
Karl, what's the history behind giving the vaccine to a newborn baby? I mean, it doesn't make any sense.
No, it doesn't make sense for several reasons. We often would we would hope that our vaccine recommendations come from the top minds in the world, but yet different countries treat it differently. And so the top minds in Europe, at least many of the European countries, do not give the hepatitis B vaccine to a newborn unless their mother tests positive. We don't do that step in America. We just blanket recommendation that every newborn gets it. A country like Finland, their top minds to conduct their recommendation schedule only give it to people who have risk factors for hepatitis B. But there are crazy reasons that we should not be giving hepatitis B to children, especially newborns. The blood-brain barrier, which protects us from all sorts of pathogens or contamination that's in our blood from getting to our brain, does not fully form until shortly after birth. It starts forming at about 12 weeks gestation, and it's not like fully closed until a week or two after birth. So anything you are giving in that first days of life, there is no blood-brain barrier for that infant. And that barrier is not even sort of matured to how it looks like in an adult until about 6 months of life. So I would be awfully picky about what I'm injecting into a newborn. Um, and for me, the most alarming thing about the hepatitis B vaccines for newborns is the aluminum content. There's Endurix B is one of them, and it has aluminum hydroxide as an adjuvant, and Recombinax V HB has aluminum hydroxyphosphate sulfate, um, both of which are capable of crossing the blood-brain barrier. But like I said, it's not even a concern because the blood-brain barrier is not formed um, until sometime after birth. Um,
Karl, what about in the so-called safety trials or whatever they do with these vaccines? Didn't babies die?
yes, the safety trials were woefully inadequate. They looked 4 to 5 days after vaccination, and if you think about how that is awfully cherry-picked during the COVID vaccine um, adverse event reporting, you were not even considered vaccinated until 2 weeks after your vaccine. So any adverse events you had in the first 2 weeks after vaccination was not associated with the vaccine. When your body gets a vaccine, your immune system needs time to learn um, what we're trying to teach with giving a vaccine. And that time is about a week or two. So having a 4 or 5 day window of observation before declaring these vaccines safe and effective for kids is ridiculous.
And Karl, what about the VAERS, the Vaccine Adverse Reporting System? Do we have injuries and death on there from the Hep B?
Absolutely. So for the two vaccines that I mentioned that we give to newborns, if you search VAERS for those two vaccines under 6 months of age, there are in the United States 102 deaths and 37 reports of comas, which is it's pretty damning. There are a variety of other adverse events that can come with any vaccine. In particular, the Hep B vaccine seems to have neurological issues where we induce an autoimmunity where our immune system starts turning on and attacking our nerve cells, and that could lead to things like Guillain-Barré syndrome.
Well, but many of the viewers may remember the story we did on the bus of those two twin boys. I think they were age 2 and they couldn't even hold their heads up. That was from Hep B. We've seen some horrific injuries from that. And so by the age of 2, these children have had 3 Hep B shots.
Right.
And correct me if I'm wrong, according to the article, pharma are earning billions from this shot.
Yeah, and that just the dollar value itself just gives me pause. Like 2 or 3 vaccinations to children under 2 for something that they have almost no risk factor for. I mean, your risk factors involving a hepatitis B, you get it from dirty needles, you can get it from unprotected sex, you can get it from blood transfusion, but extremely rarely, and you can get it from organ transplant, but I mean, also extremely rarely. Um, if if you want to see a medical doctor who's fresh out of medical school really squirm, you can push them on why do we give newborns the Hep B vaccine. The best response I got from someone was that, well, they might need a blood transfusion. And I thought about that and I looked into and could not find a published study in the United States on how much hepatitis B virus is circulating in our donated blood supply. The United Kingdom, however, has does have such a study published, and they estimated your chances of getting hepatitis B from donated blood is something like 1 in 1.2 million or 1 in 1.4 million, which means that even if every child in the United States had to have a blood transfusion after birth, um, you would be inducing perhaps 3 hepatitis B infections.
Karl, I want to kind of summarize this up because it's really important. And by the way, viewers, we're not giving medical advice, we're giving informed consent. So you decide what you want to do on this. But I would really want that young mother, I want a clip now that we can sense that young mother of the true dangers, the scientific dangers that are known of this Hep B vaccine, and the fact that not just pharma are making billions from vaccinating these babies, pediatricians are also getting paid bonuses and bits of money. Paul Thomas has told us about that, from making sure that your child is up to date. So you've got to, as a young parent, understand that there's this like dark agenda going on. And meanwhile, you are putting into your child things that could and can kill. We've just talked about the fact that hepatitis B has killed babies. So can you just summarize the whole thing up for me one more time, just so we got it? So basically, you've talked about how the baby's brain is not developed, and you've talked about the dangers of the vaccine and the fact that actually if you get hepatitis B, you can actually recover from it.
Absolutely. And hepatitis B incidence in the United States is extremely low. It's one of those things that's poorly reported on. So when the CDC does a surveillance, they'll find about 2,000 people nationwide, but they understand that that's underestimated. So they have an underreporting factor of 6.5. They just multiply that and just assume there are about 14,000 people who have an acute hepatitis infection. But for infants with a mother who does not have hepatitis B, not going to have the risk factors of dirty needles, unprotected sex, very unlikely to get a blood transfusion or an organ transplant. The reasons for getting a hepatitis B vaccine are the most glaring ones are monetary, so that pharma gets paid. And if you could think of $1 billion to, I mean, what could you do with $1 billion to improve the lives of newborns? And it's no matter what list you come up with, hepatitis B vaccine is not going to be among them.
Karl, what is your advice for parents who are going to hospital to have a baby and they don't want the hepatitis B, but they know, we've seen the amount of bullying that goes on. Some parents have had CPS called on them for not giving hepatitis B. We also do, viewers, just remember this, we have Heather Ray's breakdown of the hepatitis B shot as well. So make sure you're up to date on that. But what would you do if you were going into hospital with your wife and you didn't want the Hep B? What would you give them information? I mean, what's your suggestion as a senior research scientist?
Never let the baby out of your sight is for sure. You can put no Hep B vaccine on your birth plan. You could tell that to absolutely every person who comes in to see you at that birth clinic. Giving a hepatitis B vaccine is reactionary for many healthcare workers. They will give it no matter how many times you tell them not to, unless you are over your baby and saying, "What is that? We don't want that." Absolutely.
So grave danger from the hepatitis B, from your research on this shot, what you know about it, and the science department, all of you, not giving a medical advice. Let's put it this way. Would you give your newborn baby the hepatitis B?
Absolutely not.
I think that's
I mean, right. Absolutely not. The aluminum content alone, just no. Risk factors, no. Like, there's no reason to give a hepatitis B vaccine to most babies in America.
Karl Jablonowski, thank you so much. And also for all the work you're doing in the science department. We are so grateful to you constantly. We see you all the time being quoted in the Defender. So thank you for coming on this morning. Enjoy your vacation. Thank you for coming on during your vacation. Enjoy your vacation, Karl, and we look forward to having you back at Children's Health Defence soon.
All right. Bye.
Thanks, Karl. All right, everybody. Well, now listen, this subject is something I've been desperate to get information on, and we're so fortunate to have Lisa, let me say your name properly. It's Laehy, correct? Welcome to the show.
Yes, Lisa Laehy. Hi, Polly. Good to see you. Let me get my camera right.
Okay, well, now this is really, really important. So when we got these medical records of these beautiful babies that had died, our doctors were going through them, and they kept seeing this fluoride varnish coming up the whole time. We haven't seen that before on the medical records of dead babies. So Thank you to you for coming on. Well, first of all, we want to tell everyone who you are and why you got involved in this, and then lead us into the information you have, please.
All right. So I'm Lisa Laehy, and I'm the Director of Research for the Vaccine Safety Research Foundation, VSRF. And like you said, in 1 month's time, oh, here we go. Yeah, this is our mission. We're really focused on helping the vaccine injured. We've been helping several families whose babies recently died very shortly after getting vaccinations in their pediatric visit. And at the same time, these babies were treated with fluoride varnish. And this really caught my attention because my own son, my third son, when he was 13, was diagnosed with dental fluorosis. And every time we went to the dentist, he had 4 or 5 cavities to be filled. And I finally asked his third dentist when he was 13, I said, what's going on? I don't understand it. He has good dental hygiene. Why does he have all these problems? And this doctor finally told me, he said, well, your son has dental fluorosis. And I said, what is that? And I took a deep dive. I learned all about it like we warrior moms do. I found the Fluoride Action Network. I got its executive director, Michael Connett, on the phone. He led me to a 2006 National Research Council document, a giant study that our government had done almost 20 years ago. And it was a comprehensive review of all the literature on fluoride harms, ingested fluoride harms. This is it. And it was basically evaluating whether the EPA standard for 0.7, then it was 1 part per million of fluoride in the water, was appropriate. Should we be ingesting that much fluoride, right? Well, I read this document. It was, a book basically, and it went organ system by organ system. And it said basically that low levels of ingested fluoride exposure harms not only your teeth, dental fluorosis, your bones, your brain, your thyroid, your liver, your kidneys, and your immune system, because it collects in the bones, fluoride does, where you make your immune cells. And so this fluoride interrupts this process of being able to create a strong immune system, which is really interesting, going back to looking at giving fluoride varnish to babies along with their vaccines. So fluoride, as your listeners and viewers probably know, it's not meant for ingestion. It's not a vitamin. It's not like magnesium or zinc. Fluoride is a toxin. You can go your whole life and never ingest any fluoride. This is a toothpaste warning. This is toothpaste, right, that we use every day. It says, keep it away from children. And if a child, no one under 6 should even touch the toothpaste bottle. And if a child ingests it, call poison control. Okay, so look at this. Toothpaste is 0.24% sodium fluoride. Varnish, going back to these babies, is 22.6% fluoride. Varnish is 22,600 parts per million of fluoride. In the water, we have 0.7 parts per million, right? And in toothpaste, about 1,000 parts per million in a pea size bit of toothpaste. So we are talking about a poison. When I saw that these little babies had been given fluoride varnish And then immediately afterwards, they were shot up in their legs and arms with multiple vaccines. I thought, well, this is definitely, contributing, if not, partly causal to these babies' death. One child died within 24 hours. She was 1 year old. She had 2 teeth, and they put this toxin in her mouth. And the baby, it tastes like bubblegum, apple, all these pleasant flavors. And the children are told, now don't swallow. They lay them back. In my son's case, he had it from 2 years old every 6 months on through about 6 years old. They lay them back. In my son's case, watch the cartoons. Don't swallow this bubblegum stuff in your mouth. And then don't eat or drink for an hour. Well, again, going back to these infants who so sadly died, I mean, it's just tragic how they suffered as well. They didn't even have any teeth for the varnish to set on. That's how the varnish works. There's this assumption of minimal ingestion because you put it on the teeth, don't swallow, don't do anything, and it sets. It's supposed to stick to your teeth. And some of these products are even slow release fluoride, where the peak release is a week later. So these babies are swallowing it.
Lisa, can I just interrupt for 1 second?
Yes, please.
They say don't swallow. How on earth is a 6-month-old, a 1-year-old supposed to understand? They don't understand that. So
no, they don't.
And the second question is, do you think, and this is your personal opinion, do you think that this fluoride varnish on those dead babies, do you think that could have contributed or even caused the death?
I think it most definitely contributed, especially in the case of the Shaw twins, because they had all the symptoms: nausea, vomiting, diarrhea. They're nauseated. They can't eat or drink, which makes everything worse, of course. They quickly get dehydrated and they decompensate, and it's so hard to get them back once you start that cycle in motion where the child is so sick. The fluoride literally burns the GI tract. It causes ulcers over time. It's an acid. It's very difficult when you swallow a high dose fluoride. And again, remember, 22,600 parts per million of fluoride in that little dose of varnish. And toothpaste, 1,000 parts per million with that warning. It's really a dangerous product. And interestingly, it's not FDA approved. Surprise, surprise. The way they got around a new drug application, which would require years of safety testing, right, and reporting to the FDA and FDA safety monitoring, they approved it as a medical device. And its use is for tooth sensitivity. It's never used for this, by the way. So, it's a medical device. If there are adverse events, you're supposed to report it to MAUD, which is the FDA's, medical device reporting system. Very much like vaccines. You've got all these chronic and acute harms going on. No one is reporting it. Gross underreporting. So there's really a lack of awareness. But going back to the kids, why is this happening in a pediatric visit, right? I mean, you're handling this toxin with very small children. So that really piqued my interest. And I went and found that there is this group of it's an independent panel of 16 professionals in the field. They're from pediatrics, primary care, OBGYNs, and they basically are funded through HHS to go out and find primary care interventions. Their mission is to improve health by giving healthy people screenings, medicines, psychiatric, screenings as well. So they went out and they decided, why don't we have, and it's only in the primary care setting. So they're looking for interventions to give people when they first come in to that primary care visit, pediatric visit. And they decided that giving little children these fluoride varnishes would be a great thing to do. And in 2015, the group is called the U.S. Preventive Services Task Force, and it's under HHS, and they're supposed to be independent, unconflicted professionals, all MDs. And they came out, they make these recommendations. And in 2015, they recommended officially fluoride. And then in that same year, by that same year, all 50 states had approved Medicare reimbursement, Medicaid, I keep saying Medicare, Medicaid reimbursement for fluoride varnish in the pediatric setting. And they're really going after high-risk kids. Can you read the part in the green? It basically says that primary care clinicians should prescribe oral fluoride supplementation or varnish, supplementation, dropping it into the infant's mouth starting at birth, or varnish with first tooth eruption. So the whole purpose is you're trying to prevent cavities in the baby teeth. But let me tell you something so interesting. This country, almost nobody knows this, but we have an epidemic of dental fluorosis. This is where, when the enamel of the adult teeth are forming, exactly between ages 0 and 8, they're underneath, right? The baby teeth come in, the adult teeth enamel are forming. When you're exposed to even low levels of chronic ingested fluoride, it causes what's called hypomineralization. The enamel on their teeth can't form because of the fluoride. How ironic, right? So you're preventing cavities in baby teeth, but you're destroying the enamel in your adult teeth. And let me just tell you that in 2015, while we've got this recommendation to start varnishing babies' teeth while their adult enamel is forming, on the other side, you've got the CDC releasing the numbers on the epidemic of dental fluorosis in our country. So Lou, if you can put up the chart. Well, this is a good one too. So this is what year? 41% of adolescents aged 12 to 15 have dental fluorosis. This is where the teeth are mottled, pocked, pitted, and it ranges from, just those white, chalky, aesthetic interruptions all the way to like brown, pitted deep. I think Lou showed us the picture. That was 2004, 41%. By 2016, the CDC released the numbers. 65% of US teens 12 to 15 have dental fluorosis. This is my little comparison chart. So check it out. On the left side, you've got the ADA, the American Association of Pediatrics, and this US Preventive Services Task Force putting out all these fluoride recommendations. While at the same time on the right, you've got our own government releasing the data on the fluorosis epidemic among teens and kids. So it is just astounding. The government knows that there's this massive problem. But, once again, the U.S. Preventive Services Task Force calls its partners, all of its partners are CDC, all of the health agencies in the federal government, all of the major medical associations. It's just this, once again, this medical cabal that is just looking for business and harming American children in the worst way. And I want to make a really important point. Dental fluorosis is the canary in the coal mine, right? It's the organ, if you want to call it that, or teeth are an organ. It's the part of the body that we can see. When the teeth are that damaged, and my son's were, he has a lifetime of dental problems, fillings, crowns, cavities, nonstop. He also has had x-rays on his bones. The bones in his wrist were not formed properly. Your bones don't form. Liver, kidneys, and the worst of it, the brain. What we know, which just came out in this major case argued by Michael Connett of Syrian-Glimstad, it was Food and Water Watch v. EPA, right? It was a massive win. Michael proved that even chronic exposure to low levels of fluoride, as in the drinking water at 0.7 parts per million, it poses an unreasonable risk to children. It is lowering their IQs. So isn't this interesting? We're going after these Medicaid kids and we're poisoning them with fluoride, and it lowers children's IQs. We know this. It's fact.
Lisa, this is fascinating and just in such important work that you're doing and bringing to us. But I just really, really, really want the parents to know this. When you go with your baby for 6 months and above shots, your wellness visits or whatever, they are going to try and put this varnish on you. Now, the mothers of the dead babies that I've spoken to said they had no idea that they were doing it. They just did it.
Yep.
So you need to be informed that this is happening with very, very dangerous consequences to it, correct?
So true. And even if you just go to your dentist, don't let them give you a varnish, which, in my case, I had this wonderful little pediatric dentist office with the cartoon TVs. And when you leave, you get a toy and you lay back and you get your bubblegum varnish. And I thought I was being such a good mom, doing this extra fluoride varnish for my little child starting at 2 years old. He had the bad luck of being the third son. So the oldest started at, 7 years old. The 2-year-old got it the worst because he got the most. Do not allow anyone to put fluoride varnish in your son or daughter's mouth. Do not even use fluoride toothpaste because kids swallow it. Avoid fluoride like the plague. Like the plague. You don't
Lisa,
need it.
No, you don't. You're right. And Lisa, I think it's really important that we also highlight the fact that there are bonuses to the people giving this varnish to you. So you may get that same kind of weird bullying we get with the vaccines because they're paid. There's money behind that.
Yeah, if you can get $50 for every kid that comes in the door, that's $50 on top of the dental cleaning and all the other little things they do and the cavities that they find. Let me make another point. What we don't know, we don't realize that in America, a lot of the dental products have slow release fluoride in them. And you need to know this as an adult too. If you get a crown, the cement that they use to glue the crown in your mouth has fluoride in it and it releases slowly over time. If you go to a biological dentist, and this is the big takeaway, find a biological dentist. There's a fabulous organization called the International Academy of Oral Medicine and Toxicology, the IAOMT. I have their website, maybe Lou can share it. Go on there and they give state by state a list of biological dentists. Biological dentists do not use mercury and their offices should be fluoride free. If it's a true biological dentist, they also will order products from Europe because once again, like we see with our food, the Europeans don't use crown cement that slow releases a toxin we call fluoride. You can get safer products overseas than you can get in the US, just like we're seeing with food. It's unbelievable.
Lisa Laehy, thank you so much for this amazing information. So vital that we get this to these young parents. Your vacsafety.org, if people want to follow you and find out more about your work. And we definitely want to get you back on. You speak so well. So thank you so much for all your work on this and coming on so early this morning.
Thank you, Polly. It's been a pleasure. All
right. Well, look, everyone, we're going to hand the show now over to the amazing Dawn Richardson with Advocacy Lifeline. So thank you, Dawn. Good morning. And from me to you all, I'll see you tomorrow.
Hello, my name is Dawn Richardson, and welcome to Advocacy Lifeline here on Children's Health Defense Television. Thank you so much for joining us today. The purpose of this show is to help you, to empower you, our user, to use your voice to help affect changes in law, policy, and public opinion through education and action for issues that are important to you and your family. These views are my own and not necessarily the views of the National Vaccine Information Center, where I work full-time as the Director of Advocacy, or of Children's Health Defense, who are our wonderful hosts here today. So I don't want anything I'm saying today to be construed as medical or legal advice, because it's not. It is just my opinion and my insight with all my years of legislative advocacy experience. All right, let's get right into it today. Texas has been a leader in vaccine freedom legislation for the last 27 years. A lot of good bills happen here, and a lot of bad bills are stopped for a few reasons. The first one being that the people in Texas have been active talking to their legislators for decades, and they don't take their freedoms for granted. They continually talk to their legislators every year. Texans also take their responsibility to heart to vote for legislators that are going to fight for their rights. We still need to improve in that area a bit, but what I've seen from some other states, we definitely do a pretty good job. And another benefit that people don't necessarily give credit to, but it really helps, is that the legislature in Texas only meets every 2 years instead of every year. So everyone isn't burned out, and there is an urgency to actually get stuff done when the legislators meet, because they're not going to be back for another 2 years. So I think, the less time they're in there messing with the laws, the more free we are. So that definitely plays a role. And while there are many good bills, there are also some that aren't as strong, and they could be even worse because they can set us backwards, or if they pass, or they take away some of our rights. So, it's not all roses here. The injection of lobbying from medical trade associations, hospital associations, and pharmaceutical companies has led even some of the most supportive legislators to have no choice but to accept or add compromising language to bills to just get them through and do some good. These points need to be articulated so legislators know people are watching, and this can give them the encouragement to stand up against these efforts to water down a bill. There are lessons to be learned here for every state to navigate around some of these pitfalls that I will point out to you today as we discuss the bills, so that you can watch the bills in your own state and spot these problems and talk to your legislators about fixing them. So the Texas legislative session started on January 14th of 2025, and it ends coming up here on June 2nd. And while there are literally dozens of vaccine bills filed this session, a lot of them good, we are nearing the end of session, and there are many bills that still actually have a chance to be passed. So I'm going to dedicate the show today to what people in Texas can do during this final legislative push on vaccine bills to help pass the good that are still alive and moving and kill the bad. I will also talk about lessons that can be learned from reviewing these bills that can help you get good language filed and passed in your state, and hopefully avoid some of the industry-endorsed compromising language. I've been involved in grassroots advocacy in Texas for 30 years now. I started in 1995 researching vaccines when I was pregnant with my daughter and trying to see what it would take to get a conscientious exemption to vaccines passed here. I started actually testifying at the legislature in 1997 against mandatory and opt-out vaccine tracking systems. We were able to get vaccine tracking system, the tracking system in Texas, to be a required opt-in system where you had to not only give permission to be in the registry, you also had to give written permission for a doctor to release your information to the registry. So opt-in here in Texas. Texas is only one of 3 states that are opt-in. So we're proud of that. And we did that decades ago. It then took 7 years of learning as we went. But my friend Rebecca Rex and I worked tirelessly and eventually got a conscientious exemption to vaccine mandates passed here in 2003. Additionally, we worked to support the passage of many other good bills that serve as a model for other states. I've learned a lot over the years, and I'm very pleased to see good bills being filed and passed, not only here in Texas, but in my role of assisting other states around the country through my position as Director of Advocacy for the National Vaccine Information Center. So to understand better how bills this session in Texas are moving, I'd like to review the paths that the bills need to follow in order to get the bills passed into law. So here's a little flow diagram. I bring it up every time to time because it is helpful in understanding what has to happen. So bills need to actually pass both chambers. And in Texas, that means they have to pass both the House and the Senate. Some states call their houses an assembly, and Nebraska only has a Senate. They don't have two chambers. It's the only state that only has one chamber. And so in order for this to happen, for them to pass the bills to pass the House and Senate, it can go about it in two ways. You can file two separate bills. If you see the two paths starting on the left, you can have a House bill and a Senate bill that have the same language, and they can run in parallel and get to the end. And as long as they are the same, they can get passed and go to the governor. But the more common path that bills tend to take is you have a bill that will pass one chamber and then it crosses over to the other chamber, and it still has to go through the committee process. It still has to get voted on the floor, and it still has to be resolved, maybe sometimes in a conference committee with the other chamber if there have been any amendments that make it different. So they have to pass through both the House and the Senate. Because there is so little time left to this session and some legislative deadlines have already passed, I'm going to focus my time today on bills that have passed one chamber, either the House or Senate, and are progressing on the other side. These bills have the most likely chance of passing and going to the governor. So I'm going to start with Senate bills that passed a Senate committee, the full Senate, and have crossed over to the House and need to be passed by both a House committee and the full House. And I'm going to start with Senate Bill 95. I actually went and testified on this bill in the Senate. I really like this bill. I like what it's doing. This bill requires a healthcare provider to obtain written informed consent prior to vaccination of a child, and it prohibits pharma kickbacks to the healthcare provider. It adds some penalties for violations. And while I would always like to see the penalties being stronger, these penalties are definitely going to serve as a disincentive to not following this law should this bill pass. It currently sitting in the House Public Health Committee. So it's crossed over, like I talked about, and it needs to pass the Health Committee in the House and then the full House. So you want to contact the House Public Health Committee members and your representative as well and ask them to support the bill. Senate Bill 95 should be supported for several reasons. Incentivized coercion presents a conflict of interest and interferes with the physician-patient relationship by pressuring providers to push vaccines and not disclose risks, regardless of what's best for the individual patient. Parents who refuse one or more vaccines for their children are often denied access to health care because having under-vaccinated children as patients hurts the provider's bonuses and reimbursements. The American Academy of Pediatrics published the results of a 2019 survey showing that 51% of pediatric offices have a policy to dismiss families who refuse vaccines in the primary series, and 28% have policies to dismiss families who spread out vaccines. The National Vaccine Information Center has a Cry for Vaccine Freedom wall, and on it is featured many first-person testimonials of harassment, coercion, and sanctions at the hands of doctors pressured to meet vaccination quotas, especially for children. Incentivizing vaccination is an unethical medical practice, and it needs to be stopped. This should be happening in every state where we're trying to stop this. Vaccines should not be one size fits all. Not all vaccines are the same, and not all people react the same way to a vaccine. Parents should have the final say in what vaccines their children receive, because all vaccines are pharmaceutical products that can carry a risk of injury and even death. All individuals or the parent or guardian of a minor child deserve the right to informed consent, which includes the right to be provided with unbiased, accurate information about vaccine risks, and to be able to refuse a vaccine without coercion, harassment, or penalty, or even worse, suffer access to medical care as a result of their decision to delay or decline a vaccine. Policy and law in the United States respects informed consent in medicine, including vaccination. However, in a push to get every shot in every child, parents are often left unaware of the real risks of vaccination. Passage of Senate Bill 95 can go a long way to correcting this problem and save lives. As much good as the bill does, there are some loopholes that need fixing and are spelled out on the bill posting for this bill on the NVIC Advocacy portal at nvicadvocacy.org. The section of the bill that prohibits a healthcare provider from accepting a bonus, kickback, or other form of compensation from a pharmaceutical company does nothing to address the kickbacks and bonuses that health plans receive and for fully vaccinated patients. Insurance companies incentivize certain health measures, including vaccination, to meet quality metrics from which they're rated on. These incentives can be given through cash bonuses. The prohibition on kickbacks and bonuses need to apply to health plans as well. So if you're going to have a bill in your state to prohibit these kickbacks, not just from pharmaceutical companies, also make sure it includes health plans, health insurance companies, because right now this bill does not do that. I additionally recommend that any bill that's trying to fix the problems caused by incentivized vaccination prohibit that a health plan rating system penalizes a health plan over its provider vaccination rates. Providers are being excluded from being included on health plans due to lower vaccination rates of their patients. These policies unfairly punish providers who care for children who utilize legal vaccine exemptions in their state, and this contributes to the lack of informed consent for patients in a similar way that the kickbacks and incentives do. So I love this bill. I love where it's going on informed consent. It's making a stab at correcting some of the problems with the kickbacks. But the lessons learned here that if you're going to have kickback prohibition language, it needs to be a little stronger and cover more areas. Okay, we're going to move on to Senate Bill 407, another bill worthy of supporting. And this requires a healthcare facility to include and accept exemptions for reasons of conscience, including a religious belief in vaccine mandate policies. So in Texas, healthcare facilities are authorized to implement vaccine preventable disease policies for their staff. They are not required to accept non-medical exemptions, although they are permitted to be able to if they choose to. Healthcare providers shouldn't be required to risk injury or death from vaccination as a condition of employment. All vaccines are pharmaceutical products that carry a risk of injury and even death. A much better solution here would be to prohibit all vaccine mandates by all employers, including healthcare facilities. However, this bill would help those in the industry that are subjected to mandates the most. It has passed the full Senate. It has been referred to the House Public Health Committee, so we need support there, and we need to get this through that committee and the House side. All right, moving on to Senate Bill 2119. This provides medical and conscientious religious vaccine exemptions for medical and veterinary higher education students. And the great part about this is it prohibits excluding these students during time of emergency if they've taken an exemption. So this bill right now is also in the House Public Health Committee. It's already passed the full Senate. It's moved over to the House. Same thing, we need to get it passed. And this bill protects these students from vaccine status discrimination by removing the authorization of the Executive Commissioner of Health and Human Services Commission to require medical and veterinary school students, higher education students, to receive extra vaccines not required of other higher education students, so without having access to an exemption. So this is done by rule, and they've gone too far. They have not allowed these medical students to be able to, and the veterinary students to be able to take an exemption. They're forced, and it's really not fair because these kids were raised in a state that's had exemptions available since 2003, expanded exemptions, and religious exemptions in medical even before that. And so this is discriminating against and discouraging students, healthy students, smart students, from going to school for any kind of medical profession or for becoming a veterinarian. So that we think that this would be a phenomenal bill to pass. I know it's only affecting a small population, but it's just bringing in line, treating these students the same as all other students and not discriminating against them. So next, we're going to talk about a Senate bill that passed the Senate Health and Human Services Committee, the full Senate, and has crossed over to the House, has passed the House Public Health Committee, and all that's left is it just needs to pass the full House. And this is Senate Bill 269. This requires a physician to report to the Federal Vaccine Adverse Events Reporting System, known as VAERS, a serious adverse event that occurs following vaccination administration of a vaccine that is either investigational or experimental or approved or authorized for emergency use by the FDA. This bill also provides a penalty for violations. Now, I just have to say, a huge improvement on this bill is for the bill to require the reporting of adverse events for all vaccines, not just the experimental ones, not just those that are investigational or those that are approved or authorized for emergency use by the FDA. Another improvement to this bill would be to include all vaccine administrators in the reporting requirements as Texas authorizes other professions, including pharmacists, vaccine interns, and registered nurses, to administer vaccines. This is something that happens in all states where there are additional people authorized to give vaccines. So just make sure that any bills that you're supporting in your state don't only apply to physicians. It should apply to all vaccine administrators. They all should be required to report vaccine adverse events to the Vaccine Adverse Events Reporting System, according to the state law that you get passed, but also importantly, according to federal law. 42 USC subsection 300 AA-25 requires vaccine reactions to be reported to VAERS. The problem is there are not penalties in federal law. So this is why the states need to step up and incentivize with having some penalties, people who get vaccines to actually report vaccine reactions. So good bill. Would love to see it expanded to all vaccines and for all providers. So if you're going to go about having a bill in your state to do this, just make sure it includes all vaccines and all vaccine providers. Now, switching chambers, we're going to talk about House bills that crossed over to the Senate and still that have, they've passed a House committee, they've passed the full House, and they still have to pass a committee in the Senate and the full Senate. So they've done one side and they have the other side to go. I'm going to start with House Bill 3441. This bill makes a vaccine manufacturer liable to an individual for a vaccine injury if the manufacturer advertises in the state of Texas. I love this bill. It is a novel approach, and really the House loves it too. It passed the full House by a vote of 88 to 31 on May 16th, just last Friday. It also has 61 authors and co-authors. So you're going to want to contact Senate Health and Human Services Committee members and your senator to ask them to support this bill. I support it because it establishes an alternative avenue for individuals to seek compensation for harm caused to them by a vaccine that was advertised to them in the state of Texas. While most vaccines, namely those on the CDC childhood schedule, with most vaccines, they enjoy some liability protection. Vaccine-injured children and their parents can seek compensation through the National Vaccine Injury Compensation Program, but this can be a lengthy and costly process where few petitioners are actually awarded any compensation for their claim. House Bill 3441 would create a state option for seeking compensation for vaccine harm or injury. This bill can be improved, though, by authorizing authorizing the court to award compensation beyond actual damages to include pain and suffering. By doing so, the bill would be stronger and would offer actual compensation for the harm that a vaccine injury causes to an individual. A lifelong disability, a loss of a child, or chronic pain cannot be adequately compensated or accurately calculated with a dollar amount. But the dollar amount awarded for actual damages, including medical expenses or lost wages, would not come close to compensating for a lifetime of pain or loss. Vaccines, just like all pharmaceutical products, carry a risk of injury and even death. And I support an individual's right to informed consent, which includes the right to be fully informed of all vaccine risks prior to consenting to the administration of a vaccine. Vaccine advertisements rarely disclose the true risk of vaccine injury. And this type of deceptive advertising is why bills like House Bill 3441 are necessary. All vaccine manufacturers should be responsible for the injury their product causes when they fail to disclose such risks when advertising their product to the public. The potential for product liability may work to discourage deceptive vaccine advertisements in the state. Additionally, I disagree with the committee substitutes limitation on the definition of advertising to include any posters, decorations, or other materials or promotional items concerning a vaccine that are displayed in or made available by a healthcare provider's office, or other clinical setting. I remember when my kids were little sitting in the pediatrician's office and seeing a poster of a teddy bear crying advertising the chickenpox vaccine, that it could be really upsetting to a new mom or a child in the pediatrician's waiting room. These items should not be excluded since the manufacturer is in full control over what they publish on these posters, and they know what they're doing. They're trying to manipulate. They're not disclosing the risk. They're just selling and advertising their products, and there should be some responsibility for that. So this is a great bill. All right, moving on. House Bill 1586. This is one of my favorite bills, and I'm really hoping this passes this session. This bill requires the Department of State Health Services to post a vaccine exemption form online in a downloadable and printable format, and it prohibits the retention of personally identifiable information. This bill is having a hearing today, Wednesday, the 21st of May. Hearing started at 8 o'clock. They might not get to the bill before the full Senate meets. And so you have, all throughout this day until the bill actually is voted on to contact members of the Senate Health and Human Services Committee asking for their support. There are a lot of people on the other side complaining about this bill because they're saying it makes exercising your rights to a vaccine exemption easier. Well, yeah, it's supposed to do that. You shouldn't have to jump through all these hoops to exercise your rights given to you in law. This bill, House Bill 1586, expands access to vaccine exemptions for children and families by streamlining the process, making it quicker and less burdensome and less expensive to exercise an individual's statutory right to a reasons of conscience and religious vaccine exemption. The health department has abused their rulemaking authority over the years by what they went and did was they added an arbitrary 2-year expiration on the forms. It's not in statute anywhere. And so now families have to go back and then wait for these exemption forms to come in by mail. It's ridiculous. It is 2025. We should be able to get these forms online and not have to wait for the postal service to deliver them. Plus, sometimes it takes like 3 weeks, 4 weeks for the health department to get these forms out. It's terrible. And the end result is kids end up missing school. Kids end up missing important information in their education, and it stresses families out. And guess what? It doesn't change anything. These families are not going to go and shoot their kids up with all these vaccines and catch them up just because they have to wait for a form. So this is just coercion, harassment. So this bill is great because families can just download the form, print it off. They're not going to be tracked that they downloaded a form and be put into a registry of non-consenters. People want to use an exemption, and they still have to go and get a notary. So it's not like just they can pass these forms out at school. So there's no concern here whatsoever. It's very disingenuous by the medical trade groups, pharma, and all these different the hospital groups that are opposing the bill because they say it makes it easier. Well, yeah. That's what it's supposed to do. It should not be a burden and an obstacle course to get a vaccine exemption. So I support the bill. All right. Now, House Bill 4076. This prohibits healthcare providers from discriminating against a person in the organ transplant process based on their vaccination status. It has exceptions in it, and I'm not thrilled about the exceptions. The exceptions would basically allow for a doctor to say it was medically necessary, and then this bill wouldn't take effect. So, the bill would take effect, but the provisions in it would not apply. So I think, please continue to contact the Health and Human Services Committee members. I support the bill generally, but can't get fully behind it because it basically has an exception to it that would make it not possible for it to really have any teeth. Most doctors support most transplant doctors support getting everybody vaccinated with everything, even though it's questionable how much effect it'll have because of the drugs they're on to make sure that they don't reject a transplant. So keep contacting legislators in the Senate, the Health and Human Services Committee members until there is a vote. Okay, they just had the hearing there yesterday and they still have not voted. We confirmed this morning this bill is still pending. Okay, let's move on to House Bill 4535. This bill prohibits a healthcare provider from discriminating against an individual by denying medical services. Oh, okay, we were covering this again. I apologize. And in the transplant process. Sorry about that. This next bill is 4535. I apologize. This prohibits, please bring that slide back up. 4535. Okay, great. This is what I was just talking about with the this bill requires healthcare providers to obtain written informed consent before administering COVID vaccines with a penalty for violations. I think this bill is good. We should support it. But guys, COVID vaccines were so yesterday. They just changed the recommendations. They're just changing the recommendations now that healthy people under 65 are not even going to be able to get them if they want to. So I think it's great for the elderly people that are going to be tried to sold to get these vaccines. But really, this bill would be better if it required providers to obtain written informed consent before administering any vaccine, not just COVID vaccines. This will help a small number of people going forward, but it just doesn't do a whole lot because COVID vaccines, pretty much everybody knows the damage they've done. They're not really getting them anymore. They're not even going to be available. So, but it's still worth supporting. Hey, maybe they can do an amendment on the floor of the Senate and get this bill passed and have it apply to all vaccines. That would be great. Okay. I just want to I just want to thank everybody for listening and going through this. I know it's a lot of information, but there's stuff to be learned here. You can start to see now that you can see that these bills that, proponents are saying are great, read between the lines, check and make sure that there aren't parts of the population that are being excluded or that they are going soft pedaling on penalties, because without teeth to a bill, it's just basically a statement because there's no enforcement mechanism. Make sure there's good penalties for violations for these protective bills that you're putting in place. Also, I just want to make sure that you understand that talking to your legislators is really important, and it's not too late, because getting a jump on talking to your legislators now can help get good bills filed for next session. So there is one good bill that has passed both the House and Senate, and I want to highlight it because it's kind of unassuming. People wouldn't really understand how it affects things, but this is House Bill 2789. And this bill removes the requirement that the Department of Family and Protective Services require that each child enrolled in a child care facility be tested for tuberculosis. And this is part of a very large child welfare bill. So the bill is almost over the finish line. It's passed the House, it's passed the Senate. You can contact the governor to support it. So the reason why I support this bill, it's interesting. There are forms of tuberculosis testing that require an injection to take place under the skin. And I have personally seen children who have had vaccine reactions that their parents have done a lot of work to help heal and make progress. I've seen these children regress when they get these tuberculosis tests, because the way that the test with the injection works is you're putting some of the tuberculin toxin under the skin and you're looking for an immune response. And that hyperactive immune response sometimes can cause a regression in vaccine injured individuals, and even in children who are healthy, they can have reactions. There are blood tests available now. Just so you know, if you as an adult you're ever required to get a tuberculosis test, ask for the blood test. It's non-invasive, but it's great that they're phasing this out, and it's already passed. So we just need the governor not to veto it. So that's great. So again, I want to stress that it's never too early to start talking to your legislators. Some of these bills in Texas were able to get as far as they did because they were pre-filed before the session even started. And so talk to your legislators, go to the NVIC advocacy portal, nvicadvocacy.org, and look at the bills that are being filed. Look for the support bills. Find bills that you think would be great for your state. Talk to your legislators now and get it on their radar for next session. So in my closing comments today, I would encourage you to please share this show with others, and you can go to the CHD TV website. You can go under shows, pick Advocacy Lifeline, click on the link for today's show, and share it through text, through email, post it on social media. Also, please sign up on the NVIC advocacy portal at nvicadvocacy.org. It's free, our free online tracking for vaccine-related bills. And every bill that I mentioned today, they will be linked in the show notes to the NVIC advocacy portal posting for that bill. Please consider a donation to CHD and NVIC so we can keep up this important work. I want to thank all of you today for joining us and dedicating your time to learning about the legislative process and about how to make a difference in your state. I'm thankful for each and every one of you. You are making a difference. I can't wait to do the end of year report on all these great bills that are being filed and passed. We're making tremendous gains this session, and it's thanks to all of you who dedicate your time to learning and participating in the legislative process. You are making a difference. All right. Well, we'll see you 2 weeks from today at 10 o'clock Eastern time and 7 o'clock Pacific time. Thank y'all. God bless y'all. God bless America, and see you in 2 weeks.
The government called, get the vaccine, help save lives, don't spread it. No, so we trusted in that fact. And we trusted that it was safe and effective. And now knowing that they knew it wasn't safe and effective, and we trusted in that fact. And that's what ultimately killed my husband. And these people are playing a role of God right now and taking lives, and you cannot do that. The benefit didn't outweigh anything. So, the COVID vaccine was every day, multiple times a day, was, on TV, and get the shot, and friends and family. Everybody's so worried, that people will die. And if you don't get the shot, you might, people may die because of being around you. So my husband and I talked about it, and, the government was asking us to take it to save lives. And it was proposed as safe and effective. And we trusted in that fact. And that's what ultimately killed my husband. So 4 or 5 days later after that shot, he woke up one morning very disoriented. He was repeating a sentence over and over again. I'm just getting ready for work. I'm just getting ready for work. And I'm thinking, oh, something's wrong, something's wrong. We bring him to the hospital, and he wasn't recollecting the year, president, things like that. They kept him overnight, and he was released the next day. And they said they didn't see a TIA, but he was presenting as a TIA. So he kept the appointment for the second shot at the end of April 2021. 4 to 5 days, almost approximately. Night sweats, fever, night sweats, disoriented, and he woke up one morning and said, look at the side. His spleen was all enlarged. So he went to, I didn't take him to the same hospital. I went to another hospital. He was brought in, and he had swollen lymph nodes in his chest area, swollen spleen, low platelet count. I think it was 77,000 at the time, which is pretty low. And they were looking for lymphoma. He was presenting with lymphoma. So he ended up spending, I won't go, it's very sordid. He was there for 66 days. They transferred him to another hospital, doing biopsies, doing bone marrow, trying to find lymphoma. Every test was negative, and they kept testing him for COVID. Every test was negative. Finally, a research doctor was brought in because I went to the head of Northwell Health and said, he's slipping through the cracks. Nobody knows what's wrong with him, and every day he's worse. You know, because his platelet, everything was dropping. So academia came in. They finally got a diagnosis of something called HLH, cytokine storm. Yeah. HLH is a life-threatening condition. Children are either born with it. Usually children have it, you know, primal, or secondary would be an adult. And secondary is extremely rare, but if you get it, it's something comes in your body that triggers it. So the only thing that came into his body was the Pfizer shot. And that's what at the end there was nothing else to blame. There was no cancer. So once the HLH was diagnosed, he came home for 2 months, seeing the doctor every month that he was seeing. She's a blood doctor. He was on etoposide, which is like a chemo form, and steroids, heavy steroids. He was not himself. He came home, but he was, I guess, in a remission. But we went to see her every week, and he would have his blood drawn to check his platelets and his blood count. His antibodies she would also test from, and they never went down. So the COVID antibodies from a vaccine, you know, I guess after a time they should come down. His would never go down. It's almost like he was producing more. And he was doing all right, heavily medicated, not the same person. And our last time he was home for 2 months, and then in the end of September of 2021, he wasn't doing well. So we went back in to see her, and right on her table, he laid down and his eyes rolled back. He's lost speech completely. They had an ambulance bring him to Manhasset Hospital, and they intubated him. I don't know how long he was intubated, you know, it was a long time. He did come off of it, but he was, we were just all praying, you know, that he would be okay. He seemed, but his blood counts, his white blood cell counts were down. He was getting blood every day. He was getting transfusions. He was getting platelets every day. I remember asking, well, do these platelets have the vaccine in them? Do they have the antibodies in them, in the blood? Can we get blood that doesn't have it, you know? And they thought about it, and, you know, because if you're giving him more blood and it has the antibodies, it's going to make his condition worse. So actually my son was a match for my husband, an exact match. And my children were not vaccinated. The doctors said they can't be vaccinated because we don't know why, but there's something this vaccine did to him. And your children may carry the same thing, that could potentially kill them. So 2 days before we had arranged for my son's blood to be drawn and, set it all up with the blood bank, I forget, my husband died in the hospital. This man just retired. He was 60, everybody loved him. He was one of those, everybody in my town would call him the mayor of Huntington, like he did for people all the time.
Vaccinating, right?
No, the government called, get the vaccine, help save lives, don't spread it. No, so we trusted in that fact. And we trusted that it was safe and effective. And now knowing that they knew it wasn't safe and effective, I even brought with me the Pfizer documents of the trials, the adverse events, the 9 single-space pages of all the adverse events that were known in early 2021. But when it was rolled out to us, it was not even mentioned. My husband's illness is on there. It's overwhelming what's happened and what's coming out, and I wake up sometimes thinking, is this really true? But it is, because you don't want to believe it at first, I question everything, and I wonder how far up it goes in our government. Where does this stem from? Who decided to make this vaccine look good, when they knew very well that it wasn't? And they're really inclined to do nothing still. No, there are 2 bills in the House right now, HR 5142 and 43. So I'm going to be going to Washington next week with React 19 and tell my story, my husband's story, and just start awareness. They have to be held accountable. And these people are playing a role of God right now and taking lives, and you cannot do that. The benefit didn't outweigh anything. You can't, pick and choose, who should live, who should die, when the side effects are severe and deadly. 1,200 people died from the trial. Nobody knew. Nobody still knows about it. It's the very deep anger that I have. And I suppress it every day because I have to function. I have 3 children, and I know this little bit I do maybe helps bring out the awareness and accountability, and justice has to be served. My husband can't go down as a statistic on a medical journal somewhere. He deserves far more. The ill that are vaccine injured deserve far more, and the people that lost their lives. I hope just nobody would ever have to go through this with the family and taking someone's life. And the government and the manufacturers knew. That's devastating. It really is.
In June of 2000, behind closed doors at a secluded retreat in Georgia, top scientists, government officials, and pharmaceutical executives met in secret. Their mission? To discuss alarming new data. Data that showed a strong correlation between mercury in vaccines and neurodevelopmental disorders. Officially titled Scientific Review of Vaccine Safety Data Link, this would later be dubbed the Simpsonwood Meeting. We came back to the scene. All we could find was rubble where the retreat and conference center once stood. What happened in this place was never meant for public ears. What happened next would change history. But before we can understand Simpsonwood, we have to go back 25 years to the policies, the cover-ups, and the warning signs that set the stage.
Get a shot of protection, the swine flu shot.
It's in the best interest of all of our citizens.
Health Director ordered a stop to all swine flu shots.
And to grasp its full consequences, we must examine what has happened in the 25 years since.
It used to be 1 in 10,000, and now it's 1 in more than 250.
It is a perfect exponential curve.
Parents making decisions about their children's health deserve to have the best information available to them. You have studied vaccinated versus unvaccinated.
We have not studied vaccinated versus unvaccinated.
We're not sure what causes autism, but we know that vaccines do not.
Vaccines do not cause autism.
Vaccines do not cause autism.
There is no correlation. The dramatic rise in autism diagnoses, 1 in 31 children, up from 1 in 54 children back in 2016.
Scientific progress on this has been slow because scientists are frankly scared to ask the question.
Genes don't cause epidemics. You need an environmental toxin.
One day everyone will know the truth about vaccines.
Uncover the truth about what happened at Simpsonwood and how corruption in the pharmaceutical industry, along with collusion at the highest levels of public health, paved the way for the explosion of chronic health issues in our children. This is a must-watch event.
Autism destroys families, and more importantly, it destroys our greatest resource, which are our children.
Robert F. Kennedy Jr.
pledged to find out what is driving the country's rise in autism.
Compiling medical records from a number of databases. He'll direct resources to study environmental factors, exposures, and external factors.
Scientific progress on this has been slow because scientists are frankly scared to ask the question.
Genes don't cause epidemics. You need an environmental toxin, and we're going to look at all the potential culprits.
With no a priori thumb on the scale, you can't look at that.
No. I am very grateful to the Secretary for finally saying from an important public platform that this is an epidemic and we need to find the causes and we need to stop it.
Other issues PhD has been pushing for years are finally gaining mainstream traction.
Today we're announcing we are removing industry members, pharma members from FDA advisory committees.
We're seeing reports that you're considering removing the COVID vaccine as a mandatory shot for children.
The recommendation for children was always dubious. The vaccine itself does have profound risk of myocarditis, pericarditis, even strokes.
Very, 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 very few people are still taking these things. In that sense, the mRNA vaccines for COVID in the marketplace are effectively dead.
We are working together to change the federal fluoride recommendations, and we're looking at the science now. There's a direct inverse correlation between fluoride exposure and low IQ in children.
Health officials announced plans to phase out 8 artificial dyes from our food supply.
The FDA is effectively removing all petroleum-based food dyes from the U.S. food supply.
We don't have a surveillance system that actually works, and that is a crime. And we will do that right away. And I understand the perverse incentives that need to be changed right away.
When there's a political will to answer a question like this, it will happen.
We're going to change things for real this time.